Welcome back with your Eye on Health. It's Wednesday, which means Dr. Bose is in today on the front page to answer all of your health questions. Now, today we're talking about really a very serious and rather frightening topic, strokes, which can sometimes come real quick, and a lot of people may not recognize the symptoms of stroke. Go ahead and talk to us. What is stroke?
So you're exactly right. I mean, stroke is not as well known by the public as it should be. You know, most of us out there know heart attacks. For example, you have crushing pain in your chest and it goes down your arm, you get nausea, vomiting, sweating, call 911. This could be a heart attack, it could be a heart. I want you guys to think of stroke as a brain attack. So it's essentially the same thing. You see the blood vessels here, they're going to your brain, and if you have a clot in any one of these blood vessels here, that section of the brain will not get blood supply. Right. And you get certain symptoms, and we'll talk about those symptoms. I want everyone to recognize those symptoms and think of it as a brain attack and get help quickly, because if you treat this quickly, certain things can be done. Right.
So when you have a stroke, so the blood clot happens, does the clot move, and is that what causes the stroke, or what exactly happens at that place that gives you the stroke?
Well, there's many causes. I mean, it's in some form damage to the blood vessel. So it could be all those fatty burgers and pizza and cholesterol you're eating over the years, and then a plaque starts building up here, and it starts occluding more and more and more, and that cholesterol plaque just eventually fills up the entire vessel and the blood can't go. And sometimes the vessels just burst as well. So there's two types of stroke, and both types of stroke cause the same symptoms, and that's what we need the people out there to know. So
why don't we talk about those? What are those symptoms? How can you recognize stroke?
So I'd like you to act quickly, to act fast if you have a stroke, and that's the mnemonic you can use to remember it. So the first is your face. Is there a drooping in the face? Is one side of the face hanging lower than the other? And then the other one is arms. When you put your arms up, does one arm kind of drift downwards? That's just all a sign of weakness in the muscles. So face, arm, and then finally speech. The muscles that affect your speech can be affected, and then what happens is you end up getting very slurred speech, and you can't articulate as well as you normally would. And the T is time. Need to act quickly on this, very, very quickly. So what we need to do is call 911, think of it as a brain attack, and we can hopefully get that taken care of in the emergency room.
Don't go to sleep, don't ignore it, or else it could cause very, very serious damage.
Right, act fast.
All right. Dr. Sudip Bose, thank you so much always for great tips and great advice. And if you have any questions at home that you want answered here on the front page, go ahead and submit them to the email on your screen, or Guaderrama at cbs7.com, or go ahead and submit them on those Facebook pages you're seeing there. We'll be right back. Stay with us.